curiosity why.
Mad Bricks webcast,
Where the human spirit flies. Mad Bricks webcast.
Right. Welcome to the MPH webcast. This is Ramana Annam Raju. I'm the host. Today we have an extraordinary guest. That is that I met her in the Minority Health Institute with the Dr. Richard Allen Williams, one of the close friend of mine. So I tell you, her background and everything is mesmerizing for everybody to really motivate in life. So I came. Before I introduce you, let me tell you something about the inspiration, people like her, where it comes from. I came from a small village in India. There is no running water. There is no small village, very small village. There is no electricity, and there is no healthcare. There is no non-existent. My father is a village doctor. He is doing both the teaching and doing the job of a doctor there in a small village. One day I heard a woman screams in the 2 blocks away from me, and then I was listening the whole night. It's just a big screams. I was 12 years old, and my father went there, and the middle of the night, and then in the 5 o'clock in the morning, the screams went dead, and my father came with a grim face, and I asked him what happened. She died with ectopic pregnancy. So nothing much he could do, and he was very sad that he couldn't provide resources for her. So that is a story that Dr. Ramos can live in central Los Angeles, South Central Los Angeles. He can relive that kind of experience here. That is, let me introduce you first. It is a great honor. Let me introduce you. It is a great honor to welcome Dr. Diana Ramos, California Surgeon General, and the first Latina to serve in the important position. Most states have health commissioners or directors. California also has an office at the Surgeon General, providing a powerful statewide voice for the preventive and policy population health. Somewhat analogous to the public health leadership in the United States, the whole general. I met Vivek Murthy, previous Surgeon General, a friend of mine. Dr. Ramos brings together medicine, public health, business, and innovation. She earned her MD from the USC, MPH from UCLA, and MBA from UC all the way California. One important example of her preventive approach, this is my favorite one actually, is prima. There is in my language there is a definition. Prima means love actually. Prema means love in my language, in Telugu in India. The preconception medical assessment, an initiative helping women identify health risks before pregnancy, including cardiovascular and other chronic health diseases. Now, their leadership connects women's heart health and maternal health, preventive technology, and population health, recognizing the healthier woman mean healthier pregnancies, healthier families, and healthier generations. Dr. Ramos, thank you for joining with us. Thank you for joining your leadership and show to nearly 40 million. It is truly a privilege, and welcome, Dr. Ramos.
Ramana, it's such a pleasure to be here with you. Thank you, and I'm very grateful for the opportunity.
I was talking about my experience in my village in India. So you are, I saw a little bit about you, and you said that you're staying in the ER room with you don't know why emergency room. We are going to the hospital so many times. So tell us a little bit the story, the personal story, very compelling for us.
Yeah. So when growing up in working in the emergency room and just actually being a child, grew up in South Central Los Angeles, and my cousin was oftentimes sick, and we would go to the emergency room as our place of care because our mothers would work during the day. And we see this oftentimes, unfortunately, that people aren't able to access care during the day because they have to work because of transportation reasons. And I love the fact that you're focusing on technology and how we can actually now change that paradigm and build the bridge so that health and healthcare and caring for those who are sick in the middle of the night can be now accessed virtually, and then go in person to the ER if needed. So this is a wonderful opportunity for improvement.
The most the most advanced countries still have a problem of that access and access and equity is still we are struggling with it. And then you're one of the uh, frontier women that trying to solve that problem through technology, through other areas. That is really appreciative of that your effort. Let me ask you, this is one of my favorite one. I didn't read until recently, but one of the initiatives I loved about Prima. Prima is a what I was surprised about you is that you have to have some mathematical mind for that. Prima is a statistical models, two statistical models. He combined them together and came up with what is it called, the adverse childhood experiences, something like that. Is connecting them to the pregnancies and maternal health and the cardiovascular disease. What a connection that that is a super genius idea. That is, tell us a little bit about that. Your experience of the Prima, how you did that.
You're very kind. So Prima is our preconception medical assessment, like you said, and I love the fact that in your language it means love. In Spanish, it means cousin, and we purposely named it a word that could assimilate or be familiar in Spanish because in California, 48% of the births are to Hispanic women, and Prima typically refers to somebody that you trust, somebody that you want to talk to. But what was happening is when I was seeing patients, I cared for patients as an obstetrician gynecologist. I saw patients one at a time. And now, as Surgeon General, my task is the 40 million in California. And so what I realized was an opportunity to be able to proactively identify and understand your health before you even start to think about becoming pregnant. Oftentimes, people don't start their healthcare journey until they're pregnant. So imagine if you don't become pregnant, you may not start your health journey at all until you're sick. So we need to change that paradigm. So Prima is one of those ways that we did that. It's 8 questions and it's based on the OB comorbidity index, which is a validated tool that is used on labor and delivery when somebody enters a hospital to have a baby. And it identifies those patients that are going to need an ICU admission or perhaps a C-section. So very high risk. So we diluted it down to 8 questions that can be completed in the community, on their phone, on their own, and it is private. So a person completes it and they just start to think about their health. Oftentimes, we plan for our driver's license, right? When you're a teenager, you plan for what college am I going to go into? You plan for weddings, quinceañeras, but we are not planning our reproductive life. And so Prima is that one opportunity, and it's on primaca.org. So primaca.org if folks want to take a look at it
Yeah,
and
so you
help
can
us.
put that website. Yeah.
Yes. So Prima is one of those ways that people can now learn about their health. And so many times I would have patients say, I wish I would have known when they were pregnant. I wish I would have known that I had high blood pressure and now that's now complicating my pregnancy. So Prima is that solution for I wish I would have known. It helps you be proactive.
Dr. Ramos, what is surprising about that? It's not just a flyer, it's a clinically validated trials. That 8 questions came from a scientifically validated that flyer. It is amazing that 8 questions can do so much powerful work as information can do a wonders in this one. And that's a technology, is a powerful area. AI can play a role there, right? Artificial intelligence can play a role, right? That is the power of that. So give us a little bit about that. This is a scientifically validated program, and then it is really can identify the risk a lot of risks in the Prima. So that is the one thing people should should really, not only Latino women, all the women in the world should do that. It should be actually applied to all women in the world, in my view.
That's right. And we actually have validated PRIMA in English and Spanish. It was done out of Stanford University, and the questionnaire has been validated for understanding, for completing. And now there's another validation that has come through UCSF, our partnership, there to validate that it can detect early on risk if it's used in the medical setting. So the first prenatal appointment, if it was to be used, it can predict if the patient is going to be high risk when they deliver their baby. So absolutely, it's a simple 8 questions that are easy to understand, but that predict risk for not only heart disease, but also for anemia, for diabetes. Yes.
Yes. Dr. Ramos, just recently, you were meeting with somebody. I saw that cardiovascular health, women's cardiovascular health is a very important. I attended a lot of Indian doctors' conferences sometimes. I'm not a doctor, I'm a physicist, basically. I'm a technology guy, physics and technology background. But I think that the connection between the cardiovascular health of women, and that's a very under-recognized in a lot of ways. How do you, how that is one of the things you're bringing to the forefront of the public. Tell us a little bit about that, your meeting and your
Yes. So I think it's important to highlight the fact that 51% of the population are women, 51.
No.
And cardiovascular disease is the number one cause of death for women. So oftentimes we think of breast cancer, ovarian cancer, colon cancer. It's cardiovascular disease.
Yeah.
Now, it sadly is also the most common cause of pregnancy-associated deaths. So it's killing our moms. Yes, it's killing our moms. And the saddest part is that 80% of those deaths of the moms that are related to cardiovascular disease were preventable.
Yeah.
They didn't need to happen. So we have our medical care that is amazing, that is awesome when we're caring for patients in the hospital. But when moms are leaving the hospital, that's when they're dying more. Over 60% of the deaths are happening after they leave the hospital. So this is an opportunity for us to address the most common cause of death, which is heart disease, and then to help the mom stay connected. So with technology, that can be the bridge to connecting the mom to health, right? With a new baby, oftentimes moms are so busy caring for their baby, they forget about their own health. And so cardiovascular disease is important to really focus with the moms. Even more critically important because cardiovascular disease, pregnancy is a window to future health. So if a person had high blood pressure in pregnancy, they have about a 60 to 70% chance to have cardiovascular disease for the rest of their life, forever. So it's an opportunity for us to make a difference.
I live in Silicon Valley now, but I'm originally from Atlanta, Georgia. We saw very high incidence of those things. One of the things that you connected very well about the cardiovascular health and the pregnancy, there is a connection that is I didn't see. People see diabetes, that the pregnancy related diabetes, hypertension, but cardiovascular disease could be another factor there. That's a really brilliant way of thinking about that pregnancy part of it. Let me ask you, you worked in the Kaiser Permanente for a while. I interviewed a lot of people from Kaiser. CEO Dr. Robert Perla is on my podcast 3 times, and Larry Hamilton and a few people out there in the main group. They came on my podcast. But let me ask you, now you're in the different position. You're not delivering babies anymore. You're looking at the 40 million people health from 30,000 feet high. What do you see when you're working in the groundwork? What do you see differently from that 40,000? What you miss it? You think that when you're working and every day in the delivering babies up there, and now you're a different position. What do you see difference? That's what I'm asking.
Yeah, so it was an honor to care for patients one-on-one as an obstetrician gynecologist, but now as California Surgeon General, like you pointed out, 40 million people in California. Really, what is the difference is my concern and hoping that patients will be able to get the care that they need. So how do we get patients through the door, through the virtual door, through the care that is going to keep them healthy? And so with that in mind, we need to think of prevention. We need to think of wellness. We need to promote getting an exam proactively and having healthier lives. So it's more of how do we use the data? How do we use programs that are already available to help people meet them in their community to provide the care where they need it and how they need it. So that's also critically important. The language, keeping in mind that they may not have the transportation, and sometimes they may not have the ability to leave work because they have to earn a living to care for their family. And that also is a big factor we need to not forget when we're trying to promote wellness and health.
Dr. Ramos, that is a very, very powerful example. I'm designing a technology there at this time. Is that user experience has to be not only just from the doctor's exam room, it has to come from home, how they come to the office, and how they come and stay out in the waiting room, come inside, and then go back and pick up the pharmacy, and then go home. It's a huge trip, and then after the side effects and all those things. It is not we didn't put that comprehensive process. I think technology could solve that problem, in my view. But yeah, you love technology. I think where did the technology play a role in this kind of things?
Yeah, no, technology is so critically important to realize that technology is a supportive partner for providing the care and getting people that human touch that they need. There is no technology that could ever replace that human touch. And the one thing to keep in mind is that when you do create, and I love it that you're innovating, and when you do innovate, that you keep the human in the center. And really, it's that human in the center that is going to make your device, your app, more successful, right? Because we need to not just be collecting data, we need to be able to provide the information that is going to help a person take action to stay healthy or to get the care that they need. What do you do with the data? And this is what I keep on hearing. My wearable is collecting data, but I really don't know what that means. And that's the opportunity that we have, is to educate so that people can be empowered and get the care that they need.
Yeah, I can help quite a bit there in that area. The massive amount of data that it can take it and then can analyze that data and then can give a little bit better view before hitting all the 40 million people hitting you, calling you every day. It's easier for the AI to handle the massive data sometimes. Let us talk about this. You went to the best schools in California, but all the UCLA, San Francisco, everything that has the best care, but still health inequities exist in California. I see in front of even in Silicon Valley, I see people going, sleeping on the streets and then mental health problem, all kinds of problems there. How do you address that kind of a problem?
Ramana, you bring up a great reminder, and the reality that 80% of health happens outside of the healthcare setting. 80%. Yeah. So we have the most amazing universities, medical centers in the world. We are leaders here in California. We house them, but we need to be sure that we are addressing the social determinants of health. So is it that they need transportation? Is it that they have the ability to be able to see a provider during the work hours? Do they understand that not only the system, but do they understand the instructions on how to actually access care? We are in California the most not only diverse in terms of educational system, but in terms of leading technology as well. So we've got the major and most impressive medical centers. We also have technology, but most importantly, we've got that diversity of our population. California is so diverse. We are the equivalent, our population, of 21 states. 21 states, if you were to compare us. So all of that diversity is so critically important to leverage. And keep in mind that if we're creating something, if we're implementing something, we need to go to the community and ask them what works for you. How should it be delivered? Do you even have access to the internet? Do you have access to transportation? What is it that is going to make a difference? So yes, we've got the buildings, we've got the brick and mortar, but we have to remember that health happens outside of the healthcare setting.
You know, the Silicon Valley, where I'm in now, we are good at producing all kinds of technologies. We don't know what the purpose is. What is that? How do you tell them? How do you kind of navigate them? Hey, this is for humans. It is a prevention is plays a central role, and then you need to really design the healthcare systems first. That's helping humans to prevent major diseases. That is right. You are in the center of it, not too far from Silicon Valley. You are. So that is really. You could be a great voice actually for all AI companies, and if, AI original companies or health related companies, all of them could be a great voice. You can be what the AI can do. You think in the future. Now you don't need even sensors, right? You can look at the phone and then a lot of things can pick up right now. So tell us a little bit about this. Your policy about that. How do you approach the AI companies? What is your message to all of us?
Well, first of all, we don't have AI in my office, so really important to understand. But the Governor Newsom, has regulations and
For prevention, what kind of things you want to give to AI? You don't have AI in your office, he said. But what
yes.
is it?
So in terms of, just recommendations for those who are using AI, I think it's important to use it proactively and be able to provide recommendations for people to take action. Some of the partners that we have spoken with already have an integrated electronic medical record, and they can proactively identify those patients that are going to need care by simply perhaps using Prima proactively and identifying, wow, this person has, if they were to become pregnant, they may have complications. And so maybe we will proactively reach out to them. And that's where AI can come in. AI can pull out identify those people and proactively say, it's time for a wellness exam. It's time for a health exam, so that prevention can be front and center and can help navigate the care that people need. And oftentimes, because they don't know the risk factors that they potentially may be living with, or the fact that they may have a chronic medical condition that could impact a pregnancy, you're now proactively taking actions to promote health. So that is an easy reach, I think, for those healthcare companies that are already integrating AI and can just pull the high risk patients.
So as you said, that California is so diverse, right? So what is I'm Indian, then some of the Chinese, my friends have, then Latino population, Hispanic population. I'm in Atlanta. Atlanta is a black population is very high. So I seen all of them. It's a struggle. That is there a cultural thing play a role in the education wise, or in running their message to the overall population?
Absolutely. You need to know who you're trying to help. And an example of that, yesterday, we had a community roundtable meeting focusing on cardiovascular health. How do we speak to the diverse communities, diverse ethnic groups like you described, Ramana, in California to start to think about their heart health. And we heard it from the Black population that they may not trust the healthcare system. So we have to identify, well, who is the trusted person that they need to help? They need to hear proactive messages, preventive messages from. From the Hispanic population, we heard that they trust the healthcare team, they trust their physician, they trust their nurse. So it really is knowing your target population so that you can promote the way that resonates with them. But most importantly is building trust, because without trust, the innovation, the technology that is being created, it's not going to go anywhere. If the people don't trust the information that is being collected, they're not even going to buy your device or use your app. It's just going to be left at the table. But getting the right spokesperson, getting the right trusted voice, that's going to make a difference. And that could really push health up for everybody.
I strongly feel health is a human right and everybody should be taken care. Nobody should be left out without health care. We are humans. We get that diseases. What is your future goals of this, your office right now? You just give us a little bit before we can, yeah.
Yeah, so we are really focusing on completing our goal of reducing maternal mortality in half by the end of this year. And looking at the data, it looks like the next set of data is going to show that we're pretty much there. But most importantly is identifying the private-public partners that are going to make our work sustainable. And this is so critically important because we are not creating ideas and programs and promoting education for one time. We want this to be part of the norm. So Prima, like you highlighted, Ramana, I would love for health plans to be incorporating this. I would love for schools to be promoting just awareness by doing the 8 questions with Prima. With cardiovascular health, having community voices be the ones to promote talking about the importance of heart health and realizing that it starts with the heart. Once your heart is healthy, everything else can be healthier. And people don't know that. Like I said earlier, heart disease is the #1 killer of women. We often think of it just killing men, but it really is the #1 killer of women. So all of this, building the sustainability, building the partnerships is so critically important in what we're looking for. The other campaign that we're doing is One Small Thing. So One Small Thing focuses on new moms. Once a mom has a baby, 40% are saying that they are isolated or they're lonely, which is the biggest non-biologic risk factor for depression, right? And we're hearing so much in the news about depression. And when a mom is depressed, you can prevent and you can improve the health of the baby, the health of the family. So One Small Thing is bringing over food, babysitting, so that mom can maybe sleep, so that mom can maybe shower. For new moms, oftentimes the time goes by so fast that you don't realize and you forget to take care of yourself. So we have coupon books. So you can give a coupon to a new mom to say, okay, here's your coupon from me that I will do this act of kindness. And the act of kindness is simply maybe taking her to the doctor's appointment, babysitting. It really is just doing what was done in our countries, right? Where you lived with the grandmother, you lived with the auntie, you live with the cousins, and you all helped each other. Well, let's go back to helping each other. And that's what One Small Thing is. And we can see and we can hear if a mom is saying, I don't feel well, but I think I'm okay. No, encouraging her to go to the doctor and get the care that she needs, because over 60% of the deaths of new moms happen after the baby and the mom leave the hospital. So important.
So very good. Andrew Yang, a former presidential candidate, said that time banking is one of the solutions. Could be, that's a way of communities helping each other. But you mentioned loneliness. I met Vivekamurthy, the former U.S. Surgeon General. He was saying loneliness is like not only just but kids nowadays, they don't look at anybody, they don't talk with anybody. That's another problem. And the loneliness in the elder population is a bigger problem now. Is a 12 packs at 12, it's like loneliness is like a 12 packs a day smoking cigarettes. He said that he tell us how do you this is a massive problem. How do you want to address that? You mentioned a few things, that human touch, that you bring, taking the food up there, all those things. How do we solve this massive problem?
So I think Dr. Vivek Murthy started with the awareness nationally, but I think in California, we're starting with the mom. We're starting with, that postpartum period. And we
Yeah.
know that there is a big ripple effect. When you impact the mom, you're impacting the baby, you're impacting the family, you're impacting the community. So it makes a difference. So if we can all start with one person, then it will be easier to add more people and to address loneliness with everyone.
Dr. Ramos, what you're doing is an amazing job here in California. You're frontline and you're trying to solve the problem of, as you said, that um, adverse childhood experiences are such a powerful force. And when you have a good childhood days, even though I came from a very, at that time it was a poverty stricken communities, my father provided that love and affection and all this. My mother, that good parenting really made a difference. So I think that what you're doing is that Prima is one of the best signature task of you, and you did a really, that is a genius idea in my view. The way you came out of that thing, just put together two studies together, Stanford and other one, and then came up with a questions, validated questions. It can reduce it dramatically, the health of the, improve the health of the woman, and prevent, see the prevention. Dr. Ramos, thank you so much for joining with us. It is a truly an honor and a privilege to have you. You're a true advocate for the California. I give you last words. Anything you want to say?
Thank you, Ramana. I really appreciate the opportunity. And I do want to highlight that you mentioned ACEs, so the adverse childhood experiences, and that's something else that we're focusing on, I'm focusing on, and that's looking at ACEs with a pregnant mom, because oftentimes it's the health of the mom. So that could be if there is mental health disorders, if there's divorce, separation, or if somebody is in jail, if she has had that experience in her life, or abuse or neglect as a child, that is going to increase her risk for not only complications during pregnancy, but then the health of her child. So it really is important that moms get screened for adverse childhood experiences so children can be helped. And in California, that is something that is reimbursed to providers, is that they screen for if they screen for adverse childhood experiences in adults and in children, they can get reimbursed. But more importantly, we can start the help that people need. So thank you, Ramana, for the opportunity to share some of the work that I've had the honor and the privilege to lead in California. And my hope is that folks will hear the ideas and take it and make it their own so that the work can be sustainable and continue on.
The woman's, particularly during the pregnancy, after the uh, uh, I hope you can hear me. She is an amazing woman. Honestly, she is warrior for a pregnant woman, and preventing the complications from the pregnancy. She is truly a warrior. I'm going to present a topic on something similar to that, and it is from the past. Because we have some time, so usually we have 1 hour program. So I'm going to put it up. I'm going to talk about something that is interesting to you. It is seeing the unseen. The things that we don't see. It is the story starts in Africa, actually, and then it goes through World War II and goes through England, goes through the African continent, entire continent, and it is truly a remarkable, and then end up in science and medicine and helps millions of people. That the story I'm going to tell you. Very interesting story. Let me. This is a. I'm going to change the topic. It's going to funny. The story starts with a police officer in Alexander. His name is Albert Alexander. Actually, his daughter lives in Redland, California. Sheila LeBlanc. She's the name is. She lives in Redland, California. I actually spoke with her, with their daughter also. During the World War II, what happened was Albert Alexander was hurt. He was injured, and then he got infection, bacterial infection. Then they wanted to save him. Then the famous people already. This is Fleming, a doctor. That all three doctors. Doctor is one from Australia, one from Dr. Fleming, and then from England. All of them started trying to treat. I'm saying that I can't see that much very clear, but I hope. Can you make it bigger? Yeah, let me see that if I can make it bigger. Yeah, Alexander Fleming and Boris Chen and Howard. Howard, I think that's what I'm reading. My eyesight is going down, but anyway, let me tell you about this. So they wanted to administer the penicillin to the Alexander, the police officer, to save his life. It did work, but they didn't have enough dosage. You need a massive amount of quantities of a penicillin mold you needed. So they could not able to save him. But they found out it worked. That was a revelation. That's why Alexander Fleming won the Nobel Prize for that. I think Harvard, the Australian gentleman also won the Nobel Prize for that. So penicillin, we do not know the structure of the penicillin. I don't know how we understand the penicillin, how it works, what it does, but we didn't know the structure because sometimes people have allergic reaction. They have rashes, anaphylactic shocks, all kinds of problems, GI problems. So they don't know the structure. Still mystery is unknown. The molecule is not known. How it looks like, what is the structure of it? It is a bigger problem. So penicillin, what they did was, so that is where we enter the story of Dorothy Mary Crawford. The story comes from Africa. She was born in Cairo, Egypt. Her parents are British origin, but she was father is an archaeologist and mother is a botanist. Both of them, that she was a diplomat family, I think, traveling in Cairo, Egypt. She was born in Cairo, Egypt, 1910. So she was the two well-educated people around her, and then that is the interesting part of the story. Starts in Cairo, and then Dorothy. Her name is, I'm going to call her Dorothy or now onwards. Dorothy she was wandering, global wanderer, a global traveler. The parents are also. They traveled entire Africa, Egypt, Sudan. She spent a lot of time in Sudan and Egypt, and then studied in England. She went back to school in England, and then eventually, her father was interested in. Her father was doing the beneath the structures. Is looking for the archaeology underneath the structures. What are the things that is there? Mosaic. So one of the things that in church mosaics, that's the crystals, the way arranged it, all of them together. It is a fascinating a pattern comes out from the church, but within the crystal, the crystals are arranged in the mosaics in the churches during that time. She went to even Israel to check with her father to see the archaeology and the church related mosaics. So one of them is that she wanted to find out beneath the molecule, what is inside there. During the time, there was a new field was born called X-ray crystallography. Physics came in the picture. She earned a PhD in chemistry by the time she got the PhD in chemistry in England, and then she was traveling around the world. But she got this. It was Bragg's father and son duo. These are father and son duo. They invented this. They first time they gave a structure to this table salt. How did they did that? How can they see inside the table salt what are the atoms are? They used X-rays. That is the key. They used X-rays, and X-rays hit these atoms and diffract, and then you can find out the structure, exact structure. That is a magic of X-rays. So magics hit these atoms and then diffract, and you can do mathematics. You can do mathematics on it, and really you can figure out the structure itself. That I'm trying to, yes. Then she got this idea, why don't you make a penicillin mold into crystal? She wants to find out the structure of the penicillin. So she made it a crystals, penicillin, she changed the penicillin into crystals, and brilliant idea. Then she just found out the first time, watch this, she used the physics, X-ray crystallography, X-rays. Dorothy Hodgkin used this one and invented the penicillin structure. It is displayed in the museum, actually, that structure she did with a pencil and pen and that structure. It saved millions of people's lives. Can you see that? One woman, she's a warrior. She really found the structure of the penicillin. That is take a minute, take a moment to think about that. A woman with the least amount of resources, she did the penicillin structure. What is the advantage of the finding a penicillin structure? You can produce synthetically, or one of the things they found out is actually the beta-lactam ring is not a weak point. The penicillin beta-lactam ring, what it does is, how it works is a penicillin, it does stop the forming of walls on bacteria. Bacteria cannot form; they need walls, strong walls. It stops making them forming a wall, so they are not effective. So the bacteria is a lactam. They found out a ring, the beta-lactam ring. They call it is a magical ring. It is really it stops the bacteria to produce wall around it, and then it can create infection. So penicillin worked beautiful there. But that is really, really powerful way that what they found out, that ring is a magical healing power. I'm not saying magical in the scientific way. So there is a penicillin, that is a penicillin G. That is eventually they found out some of the gram positive, that is absorption is low. So eventually they took care idea of that, and because of she gave the structure to that, we changed some of the structure. Not the lactam ring. Lactam ring is still there. That is a very powerful pink liquid you see for children. Everybody takes the liquid. That is amoxicillin. Amoxicillin that they give this one gram positive as a wide spectrum, as a low frequency dosage, a low GI problem, other problems are less, side effects are less. So that is still penicillin is allergic. So you got to watch those people who are allergic to penicillin, because what it does, penicillin, when your lactam ring opens up, the immune system thinks when it is attaching to the proteins, it is thinking that some foreign body attacked it, and the immune system reaction, that's a fatal. In fact, could be fatal. It's maybe other reactions could be GI problems and other things. But so she was the British government, University of Oxford, honored her with her stamp, with the penicillin structure. Can you believe that? That is really a fascinating, honor for her in that sense. History of Science Museum that is displayed penicillin structure. So Dorothy Hodgkin, yeah, she didn't stop. She found another complicated structure. She went on. She is on a roll actually. She found out B12 structure. My father used to give me B12 all the times for iron deficiency or other. When I was sick, actually B12 is like a wonder drug at the time. We don't have tablets there. We have to take injection. So red blood cells increase mood regulation and bone health. It improves a lot of things. B12 is a really truly a B12 complex is a truly truly a wonder medicine. She found out the most complex structure, very complex structure. She found out that got her. So that is a. She also found the monumental achievement is she also did the insulin structure. Is how it looks in three-dimensional. From a two-dimensional structure to three-dimensional structure, she found out what the insulin. So people of diabetes 1 and 2 now diabetes see that for juvenile diabetes, all those things it's a monumental achievement. She really found out the structure of the insulin. She won the Nobel Prize for the vitamin B12 while she was visiting Ghana. She got the news that she won the 1964. She won the Nobel Prize for the she deserves a Nobel Prize in all the inventions she did. B12 and vitamin B12, vitamin B12 and the penicillin itself is a huge difference it made. After that, insulin. What else? She deserves all of that. She was a professor in Oxford, and then one of her students are Margaret Thatcher. The former prime minister of England. They did not agree together a lot of things, but she says that Dorothy Hodgkin was a towering figure in British science. Margaret Thatcher was saying that about her. So Venki Ramakrishnan, as I interacted with him just very few minutes on online. Venki Ramakrishnan, now former president of British Royal Society, he said that he was awe with the Dorothy Hodgkin's memorial lecture. I'm in awe. She's the mother of structural biology. That Venki Ramakrishnan got a Nobel Prize to invent the ribosome structure, the most complex structure in the body, ribosome. They call him ribosome reader. But anyway, he gave a wonderful tribute to her. I mean, how she did with all these things. She was on roll. She did not only the penicillin, the molecular structure, penicillin, atomic structure, insulin, and then B12. So all of them saved the millions of people's lives. She is really, truly a structural biology. If you talk about it, she is a mother. That is a. Thank you for watching. That's all I have. I think. But thank you for Dr. Ramos. She is an amazing woman, and she is also doing for a lot of things for the California state of California. We need it because this is one of the most advanced country in the world, and then we have a high mortality rate among the maternity mortality is very high compared to almost among the industrialized nations. United States is actually one of the highest mortality rates for the woman. So we need to really address this problem. And thank you for watching. And all say good night, all of you. Thank you, Dr. Ramos, for joining with us.
We are retailing their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. You can wear it, carry it, and give it.